Hello, everyone. It's Mark Brownstein here. I am so honored and proud to be presenting this webinar today. Um, this webinar is a consolidation of a event that I went to in Las Vegas about 6 weeks ago. There were thought leaders for Medicare. There were about 3,000 people there, and I went to dozens of sessions and took 13 pages worth of notes. I have been consolidating this, putting this into a PowerPoint for weeks now. And so this has been a huge effort, and I'm really proud to deliver this. What I can tell you sincerely is that no one is doing a webinar quite like this. I feel it is my passion to educate, and it is my passion as the leader of Emerald Medicare to continue to inform the folks that are working with us, prospects that might work with us, professionals that we support, whether they be nurses, case managers, CPAs, financial planners, and people in the various communities that we serve clear across the country, to be able to inform them on changes that are coming for Medicare. We are in 30 states right now that we support. We have someone in North Carolina who's not in the picture that you're looking at right here. I just spent 4 days in Rhode Island with Jackie, and Jackie is covering the Southeast. The person on the left, Michael Civitano, he's down in New Orleans, and he's covering a good part of the country, including a lot of the Gulf Coast area. We are a company that really, we care a lot. We have a lot of compassion for what we do. We have a great back office and great knowledge about this industry. And the entire staff that you're seeing on the screen is on right now. And I believe that they've been trained exceptionally well. We appreciate the trust that you've given to us up until this point. But as we go through this, if you do have questions, please send it to the individuals that you might know who are on this call. But also, we're also going to establish a AI component so that we can recap this. We're also going to establish a record feature so that we can record it. We've had tremendous enthusiasm. We have almost 200 people signed up, which is tremendous in this area. So I just want to reflect on one other thing, is that last June, Emerald Medicare put on a client appreciation event at a beautiful location outdoors. And so we really appreciate our clients very well. They're all very important to us. The other thing I just want to mention is that because we're independent, and so I'm free to give this information. And not all agencies that are much larger are free to communicate some of the things that I'm going to be communicating it. So you're hearing this from me. You will not hear a lot of this on the news from anywhere else, from any other source. So I'm going to get started here. I'm proud of my team. We're a strong team. And we continue to grow and continue to learn every day. So with that, I'm going to start the presentation. So I always say there's so many questions with Medicare. People are confused. People are filled with anxiety, whether it be on what's A, B, C, and D, whether it be about dental care or home care, or just advantage plans or supplement plans in general. But, I feel sometimes like people are screaming from the rooftop looking for information and education. When it comes to top concerns for retirees, healthcare costs is way up there. So is dental. There's no question that people want to know and understand. They're used to their current coverage with their company that they're working for. But as they get closer to Medicare, there's clearly a need to understand what their options are. But for us as a company, we really work hard to give you individualized support, because As you'll hear through this presentation, the carriers are resetting their pricing. So it's important, more important than ever, for you to find personalized guidance and objective education. I love educating people, but each of you have specific and unique circumstances and individual medical needs, prescriptions, and budgets. And for Emerald Medicare, we want to build those lifetime relationships with all of you that are here on this call. Because as a trusted resource or any Medicare resource that you happen to know, they should be able to assist you by exhibiting ethical behavior and transparency. That's who we are. Being able to review your premium cost to determine your best option as these prices are going to change going into 2025. Open enrollment is October 15th through December 7th, but things change for you all year long. And so we encourage the phone calls. We encourage you to ask our questions to my incredibly talented and knowledgeable team. Reviewing the drug costs you'll hear through this presentation is probably the single biggest set of changes, but not the only one. And there are alternative options, and there's formulary changes that are going to occur and affect all Americans that are on Medicare. But really, we encourage everyone to look for clear, objective, and unbiased advice and education. I've probably done hundreds of seminars and webinars, and I've never done a presentation carrier specific. It's always been general and broad in the education I've provided. But we also are able to vet out other resources that you may need as you go into Medicare. I belong to a number of organizations, again, CMSA, ALCA, Orion, and other senior groups that really have a whole lot of other senior services that we are proud to be able to offer as the needs come up. But 80% of first-time Medicare recipients, first time, are not using a broker, which means that they are actually calling the insurance company and going direct to them, which is fine, but they won't get the same person again. And they may be slightly moved in a particular carrier's direction. And that's what makes us independent. So here's some healthcare statistics for you. The average cost of healthcare in America is around $11,000 a year. That's the average, right? $1 and $5 is spent of the gross national product is spent on healthcare in America. It's a lot. $4.5 trillion is spent on healthcare in the United States, eclipsing the gross national product of many third world countries. 50% of all medical costs in America are pre-diabetic insulin care or medications. Okay, it's a lot. Poverty and racism account for about 60% of all healthcare costs in America. You can see where this is going. 63% of the people aged 65 and above consider healthcare to be their number one concern. Most new and existing enrollees worry that they'll get this important Medicare decision wrong. That's why they need an independent broker. But health insurance is different for everyone. There are so many options for healthcare when you're approaching 65 and retirement. You have a group coverage that you may be looking at, retirement coverage from your company. Is it better than Medicare? It needs to be looked at, reviewed, and evaluate, because there are premium costs for the employee, for the spouse, or the children. Are there substantial savings or not? I do that analysis. We do that analysis all the time and looking at benefit summaries, because one needs to review the current utilization of people's healthcare coverage. People don't often know, but there are copays, deductibles, and out-of-pocket maximums, similar to what Medicare has. But here you have choice. In a large company, you have maybe a few choices, but not nearly as much as Medicare. Getting appointments in healthcare is currently a challenge for everyone. The goal is to keep seniors healthy and independent. That's what they want. But getting appointments are more and more difficult. I think all of you can agree to that. The insurance carrier offerings of supplemental plans, they vary by your state, and in some cases on the Advantage plans, they vary by county. There are too many options out there, and that needs to be more limited. But each year, we encourage people to evaluate their coverage to ensure it's really the best fit, based on their budget and their health. So back to the basics for just a moment. Original Medicare, Part A, inpatient hospital care, skilled nursing, a little bit of home health if you're homebound, but generally premium free. B is all of the specialists, the primary care, the x-ray, the diagnostic, the durable medical equipment. Um, A and B combined is 80% and does not include drug coverage. So when you finally get onto Medicare, and this isn't a Medicare presentation per se, but when you get onto Medicare, you have to decide what is in addition to original Medicare that you want. But Medicare, original Medicare does not cover everything. And this is a long list. Routine dental care, 24-hour per day care at home does not cover it. Skilled nursing facilities beyond 100 days. Um, 20 days for Med Advantage plans. That's a key piece for a lot of people. Daycare, nutritional supplements, acupuncture, personal care, homemaking care. These are things that people need and want when they go on to Medicare or when they become um, needy in the world of healthcare and just general needs. So this original Medicare does not cover this. The other thing I just want to go over very briefly, and this is the cost for Part B and Part D. So based on your income from 2 years ago, you're paying at least $174.70, but it can go up based on your income from 2 years ago. You can see that beyond the 103 and the 206, there's also an increase for Part D. That's not as significant, but this is important for people to know when they approach Medicare. Some of the decisions that people make, entrepreneurs make, is whether they should go onto Medicare because the cost of the Part D premium could make their group coverage still more cost effective. But the good news is that there's this life-changing event form. We've helped hundreds and hundreds of people with this life-changing event form because it looks at the current year's income. And if it's lower than previous year's income, the 2 years prior, you can have the government review and appeal based on the 8 categories above so that you can actually have a reduced Part B and Part D premium and can use it as often as needed year to year. This readjusts every year. These enrollment periods, again, just to review, initial enrollment period, if you're unemployed, self-employed, or working for a company of less than 20 employees, this is important. That 7-month window, 3 months before your birthday, the month of, and 3 months after. This is when those people need to take action. The annual enrollment period is for people who are on Medicare, who are just looking and thinking and planning. And this is going to be a tumultuous open enrollment because all the changes that are coming about. People are going to be looking at October 15th through December 7th. I can tell you that it seems that after the election, people will begin to possibly look even more closely because a lot of people might be wrapped up in the election this year. Open enrollment is a very interesting time of the year, January 1st through March 31st. Not a very well-known enrollment period. This is when people can change from one Advantage plan to another or back to original Medicare for the following month. So up through March 31st, you can change it to April. In January, you can change it for February. The special enrollment period, the timing varies. The most common one that we see is certainly losing employer health group plan coverage. It can happen any time of the year. But people who qualify for extra help, low income subsidy, moving out of the state, the county, eligible for dual Medicare or Medicaid coverage, and there are many FEMA-related special enrollments that if people call us during the year, we are trying to help them find a special enrollment. Let's just say their medications have changed and maybe the plan that they're on, there may be a better one. We need to find a FEMA special enrollment. Again, keeping it simple, there are 4 choices. Employer group plan, stay on that plan, look at the benefit summary, make sure it's the best one for you. Original Medicare, 80/20, 20% is out of your pocket. It's the exposure, no Part D. Some people are on original Medicare. Advantage plans, I'll certainly talk about, but this is what a lot of folks are moving towards, are being encouraged to look towards, and or large corporations, school districts are requesting or requiring people to move to. And there are advantages and disadvantages of this. They're very low premium. They include dental, they include over the counter, they include some eyeglasses, they include other things, and they include the prescription drug plan at no additional cost. You still pay your copays, but you're actually not paying an additional premium for the prescription drug plan. The Medigap plan or Med Supplement, these are more expensive. They cover basically any doctor that takes Medicare, which is why people love it, but it is more expensive and it has none of the thrills that Med Advantage has. But a prescription drug plan does need to be added. But for peace of mind, for people who have the budget, certainly these Medigap plans are available. So Med Advantage plans, these plans are Medicare Part C and D. 74% of all Advantage plans are zero premium in this country. Even a $5 change in that premium is going to change this market, and that may very well may be the case going forward. They're offered through private insurance companies, but they're a bundle. They're a bundle with the hospital, the doctor, the prescription drug coverage, and they're, again, typically low premiums, but there's copays and coinsurance and deductibles. Those are the things that are going to change. A $5 change in copay. Many of you who are on an Advantage plan or many Advantage plans have a zero premium for primary care, or even $5 or $10. That could go up $5 across the country. And for the carrier, that's a big change. And for you, you may or may not notice right away, and you may or may not change carriers for those reasons. But coinsurance is different than a set fee. So let's just say for a moment that a MRI is $150. It could change to 10%. 10% of what number versus $150. So those are the some small changes that the insurance company can implement to increase their revenue and increase what I would call your participation, your contribution. And then deductibles aren't that common, but there are some carriers that have deductibles. So pricing and benefits can vary greatly by county. So when you move a county, you can actually change your plan, but within a particular county and a particular zip code, there could be 20, 30 or more options for costs. But there's a maximum out of pocket. For 2024, that was over $8,000. Now, you don't get there unless you're in the hospital or have surgery multiple times during the year, but that is the maximum exposure. But again, these plans include the dental, the vision, the hearing, the gym, the over-the-counter that people love that are going to change going into 2025. It may be a small change and it may not even be noticeable because every year, everyone on any plan that has a change gets what's called an ANOC, which is an annual notice of change. These small changes will be revealed to you starting October 1st. And that will make you decide to stay with the plan or consider changing. These plans are network based, so even the networks are changing, right? There's a lot of consolidation going on within many healthcare systems, and they want you to use their own doctors and their own specialists. So there is some restricting on these Advantage plans to which provider or facility you have access to. And again, this is changing and this does change every year. But healthy baby boomers without chronic conditions are certainly considering this. Advantage plans in New York, Connecticut, Massachusetts, and Maine, those are the 4 states where if you go years on the Advantage plan and you want to switch to a Medigap plan, you can do it without any underwriting or health considerations. And these advantage plans are what is also included in these is the dual plans, the Medicare and Medicaid people who have both. A big part of our work is the doctors, right? Looking at the doctors that you have, looking at the carriers. There are more carriers. This is just a spreadsheet and an example, but my very capable staff works on this. It makes it easy for you. It's the work we do. It helps you evaluate which plans might work because at the end of the day, most people are pretty aligned with their doctors or their facilities, and they want to make sure that they can continue to use those same doctors. And so, with all the benefits that are changing, with all the copays that may be changing, our bottom line or your bottom line may very well be which doctors are you actually using, and we need to check that going into the new year. So, there's oversight that's happening, right? As you know, Advantage plans are coming under a lot of criticism, and it can't be ignored for deceptive marketing, wasteful overpayments to plans by Medicare. It's happening all across the board. But the Office of Management and Budget is the final step before CMS changes become law. I suppose carriers oversee this, not the government. So the carriers actually are the ones who are going to implement some of these changes. I'm a little circumspect on how much the overseeing will take place if it's not the government, even if it was the government. But there are changes, and I'll keep talking about them. But there are financial incentives that have led some of these providers to manipulate the system, right? Including recording on health conditions that are not treated or supported in the medical records. I think you all have seen that in your lifetimes, the denial of some of these services. So there is fraud, and there are steps that are being looked at to have some oversight. The question is who's going to oversee it? CMS is doing good things. The carriers have to buy into that. So they released a rule that would increase the oversight, which addresses gaps in mental health services, annual reviews of these plans and denials. Big part of the issues and the criticism for MedAdvantage are these denials. Increasing supervision of the marketing practices. These marketing practices, people getting phone calls, people getting mail. Again, that supervision is critical. You know, who's overseeing it? Requiring these plans to provide the cultural and linguistic services to people who speak different languages, right? These are things that are being looked at. So CMS is the Center for Medicare and Medicaid Services. They're very involved in COVID and all of the things going on with that. And you've possibly heard of them, but they're looking to clean up the industry and serve seniors better. That's their mission, and I applaud them for that because they're concerned about things like unused benefits, right? There are benefits in these advantage plans like dental and eyeglasses and over the counter, um, and reducing the number of calls to consumers, reducing the sale and transfer of leads amongst carriers and agencies. These leads get sold 2, 3, 10 times, and that's why the phone calls are nonstop, is that the sale is not to one agency or one company or one carrier. It's sold multiple times, and then the consumer has to deal with fending all of that off. So reducing the number of unsolicited pieces of the mail that are often very confusing. It looks like it's coming from Medicare. People get scammed in this industry all the time, as many of you would know. There's frustration and confusing just about the enrollment process. Again, Emerald Medicare and our team, we do the enrollment process on our end, and we go into each of the individual carriers' portals to make sure we're doing it right. Reducing the number of choices for the MedAdvantage plans. We feel as a company that there are far too many and they're hard to distinguish them. They're all too similar and they need to be simplified. These are good things that CMS is doing. So they're focused on promoting ethical practices, identifying the bad behavior with the Medicare brokerage marketplace. There's a lot of bad behavior. Very few agencies work the way we do. And I say that having been around this marketplace for almost 10 years now. 60%, though, of those on Medicare do change their plans with the help of a broker during open enrollment. So that is good, so that they realize that to make maybe 80% don't do it the first time, but the second time they're looking to make sure they have the right plan. Um, but also, CMS is looking to have us and carriers implement strategies to really increase long-term value for the policyholders, to increase loyalty. Switching from carrier to carrier year after year for a $5 copay or a little more dental is not something that the carriers want to see happen. They want to see higher retention, but they also want to earn your business. Um, the election is going to impact the timing of clients reviewing their 2025 plan choices. It's just going to happen. They're going to get inundated with mail from the politicians, and the Medicare information will just get buried in the stack. So the reason why I'm doing this, and I'm going to probably do it one more time, maybe with an update prior to October or after October 1st, is to make sure I'm communicating the best information I can. But I'll emphasize the importance of unbiased client work. That is what we do, and that is what we're known for. And again, CMS is saying do no harm to consumers. That's a big statement, and we know that. So carrier updates. Aetna, which is a common carrier that we've been working with, seems to be expecting to lose about 10% of its Advantage business. It's about 400,000 enrollees. That's a lot of business because of changes that they see coming. In New York, United Healthcare's Medigap plan is the most consistent and steadiest plan offerings. Um, there are other carriers that are $50 to $75 more expensive for the same exact Medigap plan. But the price increases for United Healthcare over the last decade or more have been consistent. And that's good news. And that's one of the reasons why I like speaking of United Healthcare. But there are other carriers in other states that also have a consistent, steady, but not too large an increase from year to year. There are new carriers coming to new states without a track record. And so they can easily do bait and switch, especially states that are not New York, New Jersey, Connecticut, and Massachusetts, because they can get somebody in. If they're not healthy, they can't switch because they go through underwriting. So we like the stability of some of these carriers a lot. Medicare Advantage carriers are looking to improve their benefit design. So carriers, you wouldn't be surprised to hear this, do not encourage the use of these benefits as well as they should. There's actually only about a 5 to 10% utilization of their benefits. People get them. Maybe they remember them in the initial phone call that we or others have with them, but they don't wind up using it or taking advantage of it. And carriers also just don't have enough differentiation across many of the coverage options. They're all so similar. A copay here and a co-insurance there, and an extra $500 on dental. And so the differentiation, it makes it very difficult for clients. And in some cases, it puts the brokers in the position of, leading people in a certain direction. And so we try our best to be objective all the time based on people's health, doctors, meds, and budget. So in the past, brokers like ourselves, much larger than Emerald, have merged. And there's a profit-only mindset. This is very concerning to me. Going forward, though, the cost of capital has increased significantly in the marketplace. And so these sorts of mergers are not happening as fast as they were, but the consolidation of even the broker agencies, not the carriers and the medical offices, are happening. And their motivation is on profitability, which plans they sell, and who gives them extra money to sell their plans. But on the other hand, the carriers are wrestling with their own solvency. There's only a 3 to 6% net profit margin by the carriers for these plans. They're not making a ton of money. If they start to allow or encourage people to use a lot of these benefits that are out there, their profit margins are going to go down. And that's what they're anticipating. And so the changes that are coming are sort of push and pull between carrier, CMS, consumer. Um, and I'm always going to advocate for the consumer. On the other hand, this continues to occur. But the carriers realize they need to invest in wellness as opposed to the chronic conditions, which is the way a lot of the benefits are structured. It's really about positive outcomes. So these are some of the benefit trends that are coming. Over the counter benefits are increasing as carriers are beginning to sort of mirror each other's offerings to stay competitive. So whether it be 25 or 50 or more over the counter per month or per quarter, over the counter benefits, if you look at Walgreens or CVS on some of the labels on some of the items, you'll see it's over the counter approved. And so in many cases, if you have over the counter benefits, you can use them. But again, many people aren't using them. In-home benefits. These are being actively explored as potential new additions. Again, if people are able to get some kind of reimbursement or there's coding for in-home benefits, then people don't go to the hospital as often or the emergency room as often, and they save money. So in-home benefits, again, everything that these carriers are looking at is all for profitability, but also for better outcomes. One of the things that doesn't exist strongly enough in this country is geriatricians. These are people who are strictly working with the senior population. There's not a lot of geriatric providers out there, but there are tremendous case managers out there who really are in business to support and advocate for people in all areas. Um, the trends are to simplify the benefit options. Carriers are trying to remove the complexity and encourage the utilization. Again, who's going to enforce that? But we would like to encourage implementation because we feel like people will be more loyal to their carrier, which at the end of the day helps us service more people. Mental health coverage will be introduced and enhanced in 2025 and in the near future. That is really becoming more and more important. Mental health coverage has not been covered to a large degree, but more and more conversation and more benefits will be added. Um, 2025 and 2026 is going to be a lot of changes to the marketplace. And so some of these things will roll out slowly. Some carriers will take an aggressive stand, and some carriers will wait to see the utilization. But even gym membership benefits, these are going to undergo changes as well, because since COVID, there's been an absolute decrease in gym participation. And so in-home options have become a reality. Whether you're watching a video or you're on your Peloton or whatever you might be doing, they want to support people to do anything from pickleball to just in-home exercises, getting a little dumbbell or a weight. Those things are being covered as part of the gym or just strictly the wellness component. Dental benefits. Um, they are only under the Advantage plans currently. They are stable in that they're not going away. Will there be some changes to the dental benefits? I think there will be because that is one benefit that is absolutely needed. The statistic is 47% of all people over 65 do not have dental coverage. So again, more emphasis on outcomes across healthcare and plans. Carriers are simply sharpening their pencils and they're looking to be creative. They do want outcomes, but they do want people to use their benefits, but they also want to make profits. So I think you'd be surprised to hear that these Med Advantage plans include about $2,000 worth of embedded benefits on the average, which is often left unused by the enrollees. That's a lot of benefits that are not being utilized. But these insurance carriers, they really take a lot of time to meet with these vendors throughout the year to fully vet them and just to ensure that they deliver that on the services that they have committed to. Sometimes they'll get fired because they haven't delivered and the customer satisfaction is low, but they hold these vendors to fairly high standards. So in many cases, these are outsourced vendors on some of these benefits, whether it's dental or it's eye care. These are outsourced, but the insurance carriers can take up to a year to really vet them out. And they have to be ready for volume. You can imagine that volume is the key to really being able to implement these. But some of the newer benefits added to these benefits, Advantage Plan benefits, include non emergency transport, which is really big, food and security support, utilities, um, but only about $50 worth of benefits were added in 2024. I'll be curious to see if that number goes to zero in 2025 or whether there's a cutback at any level. But people certainly are going to be paying attention to that, I hope, as you work towards and we work towards understanding what 2025 will bring. But for the first time, there's standalone hearing aid benefits. Now, hearing aids are very expensive and they're available over the counter, but it's really for the first time that it's getting approved. But there are annual allowances, 500 year one, 1,000 year two, 1,500 year three, for whatever the premium is. So just like dental, it's not um, necessarily going to cover everything, but certainly the hearing aids and the need for them keep growing in America, and people become socially isolated without hearing aids. They're ashamed, and they don't want anyone to see them. So, the quality of them is certainly improving over the years. So again, gym membership is transitioning towards home-based fitness. The three carriers, there used to only be two that provide gym membership is Renew Active, and that's just United Healthcare. They used to have Silver Sneakers. They rebranded it. Silver Sneakers is probably the most common, but now there's something called Silver and Fit. So they want people to use it. If they're active, they're going to be in better health. So there's changing in pricing that's going on. The Inflation Reduction Act is going to impact everything. Advantage plans, prescription drug plans, Medigap pricing. So every Medicare beneficiary will be somewhat affected. I don't know what's coming. I just know that it is coming. But the most significant changes will be certainly surrounding the Part D prescription drug plan. There's no question about it. Um, for the past 20 years, Medigap plans have increased an annual average of 4% or so. Going forward, they could increase at an annual rate of 9 to 13%. That is shocking, and people are going to wonder what they should do next. Now, Medigap prices change at different times through the year, depending on the state and the insurance provider. They also can depend on the starting date of your coverage. So all of these things are happening. Many of them go up in June. Some of them go up based on your when you actually started. They don't really go up based on your birthday, but in some cases they actually have a birth date increase separate from their regular increase that happens each year. So these Medigap plans, the government is paying those bills as opposed to the Advantage plans where the carrier is paying the bill. So these Medigap plans are going to be under a lot of price pressures, especially because of the prescription drug plans. So, these changes are taking place to standardize plans going forward. The Med Advantage market has to become more standard because there are too many options in the marketplace. It leads to absolutely unnecessary confusion and heightened anxiety among seniors. They don't know which direction to go. They're stuck in indecision. If people are sort of oriented around Med Advantage plans, I often say, try them out, see how it works. And I mentioned it earlier. There's at least 3 months at the beginning of the year that you can switch from original Medicare. From a Med Advantage plan to original Medicare. But a lot has to do with when do you start your Medicare, not necessarily when you actually are making changes. But again, long-term goal, improve future outcomes, right? The carrier's loss ratio, which is premiums collected plus whatever you're paying out of pocket, right? They have to look at their actual costs of any reimbursements that are coming from Medicare. So the only way that changes at all is through your copay. I said this earlier, copays and your co-insurance issues. That's what's creating Med Advantage plan changes, is the carrier's loss ratio is changing. Now we're also talking about benefits that they're including. There's about $2,000 worth of benefits. You can see how this is becoming quite a challenging time for the carriers, and CMS is trying to do the right thing by the consumer. They obviously see that Medicare is critical. They obviously see that changes can be made. Um, my hope and prayer that a lot of the things that we're seeing here on the screen, which again took a lot of analysis to put this on a screen, is understood by the carriers enough to make the changes. Some more consumer trends. 24% of beneficiaries actually use Medicare.gov to check their pricing. It's a significant increase. That means people are trying to do some of the research on their own. Um, when we help people and they've done that, we sort of check their work to make sure they haven't missed anything. But Medicare plans need to facilitate better care and reground themselves in geriatrics. Again, back to outcomes. 30% of all Medicare clients are hospitalized to some extent each year. It's a lot. But the carriers want to avoid hospitalizations, which again is their largest expense. About 2.5 million enrollees pass away each year. And the carriers need to track the benefits usage better. I've said that many times. 74% of Advantage beneficiaries have a zero premium plan. Um, Again, 80% of people who enroll in Medicare for the first time do it on their own without broker support. We do our best to change that. We encourage people to call us. Um, but we need, as a company, we need to know what your benefits that you would use the most. What do you want and use the most? Again, high percentage of enrollees worry that they're going to get this Medicare decision wrong. The supplemental plans, these are the Medigaps. These are the ones that are simple, most freedom, national coverage, easy to understand. Yeah, there's letters N, G, and F, high deductible, but easy to understand, very much straightforward. It's the preferred choice for the affluent consumers where premiums are not an issue. You go to North Carolina and New Orleans, you're going to find a much lower premium than you do in New York and Connecticut. You can pay $100 for a Medigap. You can pay $300 for a Medigap, but they're standard. One carrier, Plan G, is the exact same as the details of another carrier in another state. But the difference is the cost and the renewal rates, as I've talked about, and customer service. But people love it. They can visit any doctor or hospital anywhere in the United States that accept original Medicare. So for many people, that's the direction they go. Certainly, we know that people in the healthcare industry, they like these plans. They like when people are on these plans. There's less denials and less friction for the consumer as well. But there's no drug coverage included in this. So you have to add a Part D based on the meds and pharmacy that you use. Prescription drug plans extreme client sensitivity to these current future expenses. Um, Zero cost on the Advantage plans, but then there are standalones. The standalones actually are as low as zero this year, 50 cents, $3.70. They go up to $110 a month with certain carriers. That's a big, big range, and that's going to all change. The annual deductible in 2024 is $545. That only applies to folks who are on brand name medications. For those on generic, that does not apply. So there are co-payments. There are 4 stages of coverage. So you can have a high price in the deductible phase, and then it goes down. And then you go into what's called the coverage gap, which used to be called the donut hole. Price can go up again. But in the catastrophic, in 2024, the total maximum was $8,000. But for brand name medications, the maximum was $3,300, which is a huge benefit. And in 2025, the maximum is $2,000. That, my friends, is the driving change to the industry. Is that $2,000 change in prescription drug costs is going to force carriers' hands in all directions. Med Advantage plans have to look at their formularies. Medigap plans, realizing that people have to have a standalone, are going to be reevaluating every part of their cost structure. These prices are changing yearly, and heading into 2025, there will be significant changes. And again, preferred pharmacies, some of you may already know that you go to one pharmacy, you pay more than another. So you should always try and go to a preferred pharmacy. And sometimes the prices aren't that different. And sometimes mail order is better. And quite honestly, sometimes mail order is not. But that is certainly the work that we do. And then there's other options. There's discount options, good RX, single care. Um, there's options that are out there that are also pharmaceutical grants that are available based on the impairment that people might have. This is just a screen and an example of what the difference in price could be for each side. Is the specific medications are the same. So you can see the difference in price for the premium and the difference in price based on pharmacy for the exact same medications. We see this all the time. People will call, they're not using Medicare.gov, then they aren't really sure how to compare this. But this is the site that we use, Medicare.gov. It gives us the information, and we obviously can help people sign up for these. But there's a lot of work that goes into this. Our staff does a lot of work, and we probably run over 1,000 a year in terms of prescription drug runs. Again, we're running this for both Advantage plans based on your doctors, and we're running this on Medigap plans based on a standalone. So Part D pricing is changing. I've mentioned that a lot. The liability to drug manufacturers has increased from 20% to nearly 60%. That liability, because of the reduction in money from the consumer and or from the government, is changing their liability. The $2,000 limit is what I said. The carriers are going to absorb this liability. They're not going to absorb a lot of this. They have to pass this on. But for medications with a cost of greater than $600, there's supposedly proposed to be an effective payment plan will be introduced so that you don't have to necessarily come up with all the money the first time you walk into a pharmacy. How that's going to be rolled out, I don't know. Sharing the information. So reimbursement compensation for the pharmacies themselves is down. I have wonderful people I know who are independent pharmacies, and they are so concerned about the changes that are coming to the marketplace. They're losing money on certain medications that they provide. So this is really pinching them as well. WellCare, many of you on this call certainly know that carrier, and they have the lowest standalone Part D pricing. But that's because they had an arrangement with Express Scripts. Will that continue? Don't know. Will their prices increase from 0 or 50 cents or $3.70 on up? I believe the answer is yes. And so we're going to be rerunning countless numbers of those to help people going into 2025. Pricing resources. GoodRx. Needy Meds is a nonprofit organization with information on savings programs, grant programs that we use to help people find these programs. The Canadian Med Store is actually not from Canada. It's a Florida-based company that has medications available at competitive prices. So that's another option. And we know how important this area is, and we certainly do our best. The other thing I'm going to mention to you is star ratings. Not many people pay attention to this, and it's more important this year than ever before. These are star ratings for all plans, and these are based on reviews from real policyholders like yourself and feedback. They evaluate customer service, they evaluate chronic condition management, plan responsiveness to determine their overall rating. You can see that this particular carrier has a 3.5-star rating. The difference between 3.5 and 4 stars is huge. They get about $1 million per 1,000 enrollees from CMS if they're a 4-star rating. So Many of these providers, again, all part of what I've talked about for the last 45 minutes here or so, is they're scrambling to get their ratings back above 4 to help their profitability. So they need to encourage their policyholders to take advantage of these benefits in order to ensure their satisfaction so that when they do a survey, their satisfaction goes from a 3.5 to a 4. Very, very important. Extra help, low income subsidy. For some people, this is the other way to get help from prescription drug costs. The income qualification for extra help has changed slightly. More people are qualifying for extra help based on their income. But if you do get extra help, it has no deductible, often no premium, and fixed lower copays. Um, in New York, there's a program called Epic. In New Jersey, there's a program, and in other states there are as well. So, those programs for people who need help with prescription drugs are available. But again, that's the help that we're going to provide. Caregivers. I've done a lot of presentations lately for nurses, for care managers, for social workers. Family caregivers often lack the knowledge to handle the medical needs of loved ones. The resources are available, but they're difficult to assess. So there's changes coming to provide caregivers with the training from the medical professionals to better handle the needs. So the plan is for a CMS to create a billing code, which is the key to reimbursement, that will pay Medicare providers to train family givers. So this includes nurse practitioners, physicians, physician assistants, speech therapists. Um, so both trainings for both groups and individuals supposedly has changed in 2024. So this is good news. So does Medicare cover home health care? An important question, right? Care at home is less expensive, but for Medicare, it's limited. So non-medical services are not covered, but Medicare will pay for home health if a senior requires skilled nursing for under 8 hours a day. Then there needs to be a review of the plan of care as often as necessary, but at least once every 60 days, or if health conditions change. So that's home health care. But some of the things that are covered, in many cases, they need to be homebound. It's physical therapy, occupational therapy, medical supplies, homemade durable medical equipment, which includes many things. Most healthcare agencies will accept people with Medicare, but won't if they can't accommodate their medical needs. So more and more important, keeping them home ahead of the hospitalization, reducing costs of care at hospitals is really the goal ultimately of the carriers and of Medicare. Quickly about dental, people say they're going to go to the dentist, 77%, 37% actually visited the dentist. So a big area. But about when it comes to dental coverage, which is going to change a little bit going into 2025, Advantage plans don't have the same dental coverage. Standalone dental policies just vary based on the details and the cost. So these are people who have a Medigap plan who want some dental. The price ranges from 30 to 90 a month per person, but they exist, and you can get between $1,000 and $10,000 worth of coverage for the year. It's okay to ask your dentist for a cash discount. And your dentist can actually help in controlling expenses, meaning they can do some in one year and some in another based on the coverage that you have. But you need to expect to pay out-of-pocket costs for anything beyond preventative services, right? So yes, cleanings, x-rays, cavities, that will be covered under preventative. But once you get into the root canals and you get into the implants or you get into any of the crowns, you're going to pay likely up to 50% out of pocket when the insurance company will cover half, but not all of it. In some cases, people leaving a job might be able to keep their dental coverage through COBRA or actually call the carrier themselves and see if they can keep that coverage once they leave the company. So many people I work with have HSA money, health savings account money, tax-free money that they have saved over the years that haven't used, and they can actually help pay for some of these dental costs with their HSA. Here's just an example of what one carrier, it's really nationwide MetLife. You can see it's $57 for 1572 for $3,082 for $5,000 worth of coverage. You can see that a lot is listed under major care. And in many cases, there's a 12-month waiting period. One of the nice things about Med Advantage plans is if you get, even if it's $1,000 worth of coverage on an Advantage plan, there's no waiting period. You can use it day one. So future plans for dental. The federal government keeps proposing to pass a Medicare dental benefit, but there's been many unsuccessful attempts. And over the past couple of years, they passed a bill that would include dental, vision, and hearing, but the bill didn't pass through the Senate. The dental benefit is predicted to cost $238 billion over the first 10 years, and the premium for Part B is projected to increase by $17 a month per person. Some people I mention it to, they say that's okay. Some people go only cleanings and X-rays, right? So that's just people and what could be. But there was appointed the first ever chief dental officer, and their role was to guide CMS towards creating these oral health programs for Medicare. And again, it's still pending. So does Medicare cover in-home care for Alzheimer's patients? Only if homebound. They pay for services related to other health conditions such as rehab, but they won't pay for non-medical assistance for the certain types of services. But they will pay for home safety evaluations, cognitive assessments, care planning, hospital stays, and of course, prescription drug coverage if they have Part D. I just made a presentation at the Alzheimer's Association. Proud to be a part of it. Big issue and an important one for Americans. And so I continue to monitor some of the new medications as well as areas that Medicare will cover. Dual special needs. These are plans that are Medicare and Medicaid. They do a lot for people, but these are people who qualify for Medicaid. 65% of people on Medicaid don't know they are even eligible. Okay, and these are benefits you won't get from original Medicare or Medicaid separately. It's the combination of these two that make these dual special needs plans. 65% of people, they don't know they're eligible, but they get a personal care team. They're a care coordinator, a nurse care manager, a social worker, a member advocate. Those are big. They get additional dental and vision and hearing benefits. They always get over the counter for health and wellness. They also sometimes get healthy foods and utility bills and safe housing. So these people get over the counter, healthy foods, pet supplies, transportation, utilities like water, electric, cell phone, internet, help with rent and mortgage. There's a real push by these carriers to really support these dual special needs plan. Again, back to an earlier comment, is that 60% of all healthcare in America is on people who are underserved and low income, right? And then there's the folks who are diabetic, right? And so there's opportunities to improve these people's lives, to go to the doctor, get the care they need, again, so that they're not hospitalized. Technology. It's still the early stages, and there's a lot of discussion on how artificial intelligence will contribute to healthcare and Medicare. We are looking at the opportunity to leverage this technology in helpful ways to make things more efficient. The carriers are exploring ways to integrate the technology in their infrastructure, again, to help improve the client satisfaction and consumer experiences. So at a smaller scale, here are some of the tasks that AI may be able to handle in the future. Part D reviews or drug runs. So there's certainly a company that's out there, and we're curious if clients are even willing to submit their medications through an AI model to deliver them almost instantaneous results to get Part D information, to be able to understand what some of their actual options are for medications that are expensive. And so that component, I mean, we spend countless hours on Part D reviews. So it's something that the industry and Emerald is looking at. Marketing efforts, content creation. Um, to refine some of our marketing campaigns, I write a lot of articles. I'm looking at blogs. I really want to continue to educate the marketplace. Um, and some of my seminars and webinars are just sort of AI'd so that we can actually get the content in a text format. So simple things that we're doing. But also there's the virtual assistant. That's what it is. Whether it's about document submission or addressing some of your inquiries after hours. All of these things are coming, and we're evaluating all of them and seeing where the marketplace goes. So I'm almost at the end of the presentation, but the changes for 2024, Part B premium went up to 174.70 and goes up again based on the income from 2 years prior. The Part D deductible is 545 again for brand name medications. Medigap, the Part B deductible is $240. And again, all of these numbers are going to go up. The maximum out of pocket, $88.50. All of this will go up, and there'll be small changes, and you'll get your annual notice of change. And it might create some interest in you to look at some of your options. But October 1st is the first time in which we will be able to share 2025 information. We will not be able to sign anyone up until October 15th, and the deadline is December 7th for the first of the year effective date. But I want to say this nicely and with a smile on my face to my friends, my colleagues, and the professionals here, is that I am the messenger, and I will continue the thought leadership in this arena because I feel it's really important for the growth of our company and the credibility of what we provide to our clients. But you all need to understand the importance of knowing your plan's potential costs and benefits, and also the importance of the integration of healthcare costs in any financial planning that you do. We certainly encourage people to advocate and appeal any denials for either medical coverage or even prescription drug coverage. A large percentage of people that do advocate and appeal win. The Advantage Plan certainly has less of a reputation of that. I'm learning a lot from folks who are in case management about areas like this, that the more we learn, the more we'll be able to share. But seek objective and independent education. That's what we do. That's what we love to do, and that's what we always do. We want to talk to you individually so that we actually understand what your needs are. But open enrollment, again, October 15th through December 7th. And, people who are getting ready to retire need to look at what their options are, whether it be looking at COBRA, looking at their family, their spouse, their children, and what options they have. But Medicare decisions for many people are often, and it's researched that some of the biggest financial decisions of the year, because it is a yearly decision. So evaluate, review the doctors and medications, consider the chronic conditions that people may have or any special health needs. But that's what we do. Both of those areas are, we think, the cornerstone. We know how important the benefits are, but doctors and medications are always the driver in 90% of all the work that we do. But fully understand the Advantage plans and Medigap options and your needs. We believe that people are going to potentially be looking, Medigap people may be looking at Advantage plans, maybe Advantage plans looking at Medigap plans. Based on the state that you live in and your health, you may or may not be able to switch, but it's certainly something that people, we believe, will be reaching out to us for. People who are Medicare and Medicaid, and you may know friends who have both. They have all these benefits that are available to them. We are your trusted Medicare resource. And our best exposure is speaking at events because we have a chance to talk to people, see them, whether it's a webinar, answer their questions, and again, gain their trust. And your trust and your support is of the utmost importance to us. And I think all of you know that. We have some tremendous Google reviews that we're really, really quite proud of. So our mission, Emerald Medicare's mission, to support you in many unique ways. We have the education. We're always going to be unbiased and objective. We do these virtual education, the in-person educations throughout the year. We take the time to consult with you, to understand, your needs. Maybe it's a financial planner or a case manager. What does your practice have? What kind of clients do you serve? The more we know, the more we can help, the more we can serve, the more we can create marketing material or educational material. But the annual coverage to review during open enrollment is critical. But you need the tools and resources to efficiently equip your clients, you yourselves, enrollees, to understand what the options are. But we're a friendly group. We're experienced, we're knowledgeable, we're here to support you. And our services are absolutely no cost. So we're all about servicing at Emerald Medicare. I hope I have made a presentation that is worth all of your time. There were 200 people signed up for this. And so I know that this was of interest. This is being recorded. And so we're really proud of what we do. And so I want to thank you all for your attention. Most of you stayed on through the whole webinar. I hope it's been helpful. Please reach out to us for any reason at all. We are open from our support staff is open from 10 to 3, but we're diligent as can be in checking messages and emails, of course, as well. So thank you all so much. We appreciate your support. Enjoy the rest of the spring and summer, and we all look forward to speaking with you in some other venue, some other time. And again, tell your friends. Thank you so much.